Good morning, everyone. I am Dr. Renee, and we are here with blackdoctor.org, and we have the lovely ladies of Quench Wellness, Dr. Chantal and Dr. Galmally. And today we are going to talk to you about cold and flu season because it is definitely upon us, especially here in Chicago. So, ladies, first of all, I need to share my thing first, but
very important.
Yes. Very important. But first, let's start with the basics. What is influenza?
So influenza is a respiratory virus. It carries some of the same characteristics or similar characteristics as cold, but there are some different things that you need to know, different qualities. So for instance, for flus, you can have fevers. You tend to have fevers. You tend to have headaches with it. You tend to have muscle aches and pains with it as well. You have overall just fatigue, and we call it malaise, but also known as blah feeling, just feeling blah. That comes along with flu. And then you have all the other symptoms of the cough that you make the yellow-green thick sputum with it. You sometimes can have the chest discomfort when you cough as well, and you can have the sore throat and those symptoms with it. And it typically lasts about 3 to 4 days, like the peak of it. But you have some of those symptoms that can linger for some time, especially the cough part of it.
Yeah, that could even go on for weeks, actually.
Yeah, it can. Whereas the difference, I think, with having just a cold is you don't have as much of the systemic symptoms. You might just have a sore throat, runny nose, a little bit of a cough, but you don't have the fever, the headache, the muscle aches and pains, and the blah feeling accompanied with a
And then even
cold.
the GI symptoms.
Oh, yeah,
oftentimes with influenza, you're also going to have nausea, vomiting, diarrhea, and you typically don't tend to have those with just a simple cold.
So that's one quick way to kind of decipher between the two.
So first of all, with the treatment, let's go with the treatment. What is the difference between flu and cold? Because a lot of people are like, oh, it's no big deal, but then they really do have flu. It's not cold.
There is a difference, right? So with flu, you do increase your risk of getting super sick. We call it like morbidity with it, how sick you can get with the infection in comparison to the cold. So common things that we always say as doctors when people come into the clinic and they have cold-like symptoms, they're like, Doc, I need some antibiotics.
Yeah, especially in the ER. Come in all the time in the ER asking for antibiotics for a viral infection.
And what do we tend to say?
No. Unfortunately, antibiotics do not work for viral infections. There's big difference between what a virus is and what a bacteria is.
And specifically for the virus commonly causing colds, that one in particular, that has to be supportive care, which means it just has to be your immune system that takes care of it. You know, you just have to let it run its course and let your fight or white blood cells do what they need to do for a cold. We can give you things to help with like the decongestion. We can do things to suppress down the cough. You know, maybe a little Tylenol if you just feel
right, or you're having a fever. Right.
But for flu, there's actually Tamiflu that we give to individuals. And there's something important that you guys need to know about Tamiflu. The best time to give Tamiflu is within 2 days of the onset of the flu. That's when it works its best.
Unfortunately, when you take the Tamiflu after that 48-hour period, it's just not as effective. And it's very important to note that Tamiflu is not a magic bullet. It's not like how you take an antibiotic and then within a day or two you feel better. Tamiflu just helps you feel better 1 or 2 days sooner than if you wouldn't have taken the Tamiflu. So you're still running the full course of the virus. You still might not feel so great for a few days, but at least you'll feel better a day sooner than if you wouldn't have taken it.
And I know we're throwing a lot at you guys, and sometimes it's hard to decipher, but honestly, if you're really not feeling well, it's simple enough to come into our urgent care and immediate care and ER and get a quick flu swab. We'll be able to know very quickly whether you have flu symptoms or if it's just a common cold.
That's very important. Then when exactly is the flu season, so people would know that this more than likely is not a cold?
So the flu season has actually already started. It starts in the fall and goes through even early spring, to be completely honest. But the flu actually peaks between December and February. Usually February is when we see the highest rates.
Yeah, definitely last year was a rough flu season for us, and the flu was extending all the way into like March time. So they're noticing a correlation with kind of our seasonal changes and how long the flu is spreading out. So just keep that in mind too. That is the peak, right? December to February, but it can start a little sooner than that and then end a little later than that, depending on, you know, your seasonal changes wherever you live.
Now, last year there were a ridiculous number of deaths due to the flu.
Unfortunately.
Yeah.
And so, can we please understand, because people, I think they don't understand, you can die from the flu.
Yeah.
And this is why it's so important to get a flu shot. So, first of all, the statistics I actually do have here. If we can get back in this iPad. Flu deaths range from 12,000, which was the worst year, to 56,000, according to the CDC. So,
And a lot of children,
I was going to say,
right?
yeah, and then they said there were 180 pediatric deaths in that 2017-2018 season. So that's just terrible. And already this year, there's been several deaths reported, children too, that have died from the flu. And look, we just started the season. So first of all, who should get a flu shot?
Well, one thing I just want to say, you're right. The flu is very, very serious, and no one's exempt from being exposed to it because, you touch door handles, knobs, you walk behind someone that maybe sneezed into your hands and touched something and you didn't realize. So anyone can catch it. I mean, recently we have celebrities that are dying from it, right? Kim Porter most recently died from it. So everyone can possibly get it. So that's the key thing to keep in mind. So then in terms of the flu shot, right, I know I get a lot of people that come into clinic and, I offer them flu shots, or they come into the hospital and we offer them flu shots and like, I don't take that. Why do they say they don't take it? It makes me sick.
Yes.
I hear that all the time. It makes me sick. I'm not taking it. Or I know a friend at the beauty salon, she took it once and she got sick from it.
No, she didn't get sick from the flu shot. It's probably that she may have already been getting ready to get sick, right? Or she could have had a mild inflammatory response from the flu vaccine, which is a good thing, actually. That means your body is learning the flu, and so that when it sees the flu, it's able to protect itself.
The best way I could describe it, right, is whenever you get exposed to viruses, let's say the chicken pox, for instance, you get exposed to that virus. In order for you not to get the chicken pox again, your immune system has the task of developing immune and antibodies to it, so that if you get exposed again, you do not get it again. Your body has already recognized it and can fight against it.
Exactly.
Your body does the same thing for viruses that you're exposed to.
Right.
And so that's what the flu shot actually does, is it actually kind of builds up your army of white blood cells, so the next time you get exposed to the flu, you have the defenses to fight against it.
So feeling achy for a couple of days after the flu shot is nothing like being sick for 2 weeks with influenza. Completely different. And then we did also want to make sure that we know that you were talking about children and other people who are susceptible to the flu and even could die from the flu. We always have to think about the vulnerable populations, right? So children are definitely in that category. Their immune system is not as strong as those of us who have been around for years, seeing all these different viruses and illnesses.
To all these viruses and illnesses.
You have to also think about your elderly population whose immune system is also declined. Our chronically ill patients, so people with
asthmatics,
COPD,
absolutely,
even like diabetes, high blood pressure, high cholesterol, like
heart failure,
all
liver
of those
disease.
things, can also affect your immune system. We think about pregnant women, and their immune systems, and then there's this whole other category of healthcare workers. Like we are, even though we're in the hospital and we're seeing people who are ill, we are also we get exposed to this these different viruses over and over and over.
More touches, right?
Exactly, and so we're also at increased risk too. So I mean, those populations especially need to make sure that they're getting the flu shot.
So I know in recent years they've said there's all these different strains of the flu, and even if you get the flu shot, you might still get the flu because you didn't get it for that strain.
That's true.
So there's always a shortage of flu vaccine. Why is that?
Yeah, it's not perfect. Medicine is not perfect by any stretch of imagination. If we want to use last year as an example and how many people got sick from the flu, the reason why that was is unfortunately the strain of flu virus that we had, that we made the flu shot out of, was not as effective, right? So how this whole flu shot works is we look at the strain from last year, right? And you have scientists and biochemists, and they look at it and they say, okay, how do we think that this virus is going to mutate for the next year? And they tweak the virus. They tweak the flu shot, to compensate for that, right? It's not perfect. The virus is a living thing.
And very smart.
It's a living thing.
Yes.
It adapts, right?
Exactly.
It gets smarter. It's like, it's trying to survive too. So it's like, okay, I need to survive during flu season. What do I need to do to survive?
Right.
So we're doing a lot of guesswork and, hypothesizing on how we think it's going to mutate and then developing a shot according to that, right? And sometimes we're on the money. sometimes we're a little off, right? But here is what I think is the benefit of the flu shot. We already talked about the at-risk population, right? And even if you were to get the flu after you have taken the flu shot, right? The benefit of the flu shot is it then weakens, it shortens the course, and it also decreases the intensity of the symptoms that you have. So there is benefit regardless, right? If normally you would have had the flu and been out of work for 7 days, thanks to your flu shot, maybe you're only out for 3 days.
And I mean, that could be the difference between life or death.
Absolutely.
Right?
Absolutely.
So we don't know obviously exactly what was Kim Porter's cause of death. They actually they did do an autopsy and they haven't released the results yet. But it was told that she wasn't feeling well. She told her doctor she wasn't feeling well, and we don't know what happened, but she didn't, she went to sleep and she didn't wake up. And so if you, like, I guess what would cause someone to say, oh my God, I need to go to the hospital?
I'm sorry.
No,
go ahead.
please, girl, go ahead.
So I always encourage individuals to listen to their body. I think that's number one, right? You know what it feels like to have a common cold. I think everyone has had that experience. And you know when, hey, this is not the same thing. You're feeling that rundown. You're having fevers of 102, especially you're starting to feel short of breath and you can't breathe and, you're just not feeling right. You can't keep any food or liquids in.
Absolutely.
That's the sign that I need to come in and get checked out.
And sometimes you may have to be the advocate for someone else, and I see that oftentimes in the emergency room. It'll be their mom or their husband or their kids that are like, okay, I know you've been sick for a few days, but something is just not right. And so if you are around anyone who you see is just not themselves, more fatigued, lethargic, not able to get out of bed, not eating, not drinking, that means they could even, you don't even necessarily need to die from influenza. You can die from dehydration.
I'm glad you mentioned that.
Yeah, I mean, you can die from the complications. Someone can have influenza and get a pneumonia.
And that's commonly what happens.
Exactly. So, it's just, if you can be an advocate for someone, that can also save somebody's life. But, Dr. Chantal was right. We're talking fever that doesn't go away with Tylenol or Motrin. We're talking, risk of dehydration with vomiting and diarrhea, fatigue or malaise or lethargic, confusion. If they don't know, they don't know what day it is or what holiday just passed, or they're not acting right, speaking right. That could be a sign that this infection is overwhelming their system, and they are definitely at risk for serious complications.
Yeah. And you hit on those complications already, dehydration being a huge one.
Yeah.
Especially when you're dealing with your pediatric population. I always call it the telltale sign of sickness. You can always tell when a child is just not feeling well. Yeah. When they're not running through the house and tearing it up, they're not feeling well. And then another telltale sign is, how many times are they going to the bathroom? Pay attention to that. If they only went to the bathroom one time the whole day and there was a little bit of orange urine, we're behind the ball on our hydration status. And then you're right, overwhelming the system. So that comes in the form of, converting over to pneumonia, which commonly happens,
very, very
right?
often.
But other signs of overwhelming the system, our elderly population, I see them go into kidney failure because it tips off their heart failure. Oh my gosh, diabetes goes out the roof. I mean, sugar's 400s, 500s when they're sick. So you're dealing with all these type of complications that can come from the flu virus, and that can then lead to their death.
And so, where can people get their flu shots?
So you can get flu shots with your primary care doctor, but you can also go to Urgent Aids and get your flu shot too. It doesn't have to be a long or big ordeal.
And so that could be your, all these little clinics that the drugstores have.
Absolutely.
They will have flu shots as well. I think I've even seen flu shots at Costco and Sam's Club on that.
Oh, really?
No, I'm pretty sure.
I don't have a membership.
I don't either. Sure. Look, I don't either. My parents do. And so
I'm kind of glad that we're making it so accessible to individuals, right?
So so you really should, if you need to figure it out, Google it, figure out exactly where, and go get your flu shot. It's not too late, right?
No, absolutely.
Not at all.
So definitely go get your flu shot. So
we don't currently have a shortage, so
right, not yet. See, not yet. So on the other side of that, what can we do so that we don't need to, so that if, God forbid, we do get sick, at least we have the immune system to fight it off, and we, don't go through the 7 days of, being sick.
And I think this applies in general to not just the flu, but also colds, right, which are far more common. So you're right. It's all about your immune system. Like I just said earlier, when a person comes in with a cold, we're like, hey, you just have to rest. Let let your immune system rally and take care of it. So what are the things that you can do? I think everyone knows the common things of washing your hands. But I mean, I feel like I can't reiterate it enough, right? Wash your hands. I mean, wash your hands until they're dry and you just have to have lotion in your pocket.
You can also use hand sanitizer too if you're not readily near a sink with soap and water. But hand sanitizer or soap and water, it kills the germs. Like that's as simple as it is, so that you're not able to transfer it to somebody else. That's the number one thing you can do.
Another thing that I like to do in my house is ever so often I go through and I wipe all the light switches.
You Lysol everything.
Oh, I Lysol it up.
It takes like an hour and she just Lysols everything in the whole house.
Listen, Facebook and Instagram family. I have 2 toddlers at home, okay? I'm just going to put this out here. They come home with superbugs. Okay, you have kids. I mean, it's like whole times 3.
Right.
Okay.
And then they're passing it back and forth. So it just never goes away.
You ever try to explain to a toddler how they should cover their mouth every time they cough or sneeze? Yes. You know, you're talking to them, they sneeze right in your mouth. So we clean off all our door handles, our light switches. I even go as far if they were to catch a cold, I switch out their toothbrushes too. And I feel like that's a good idea for other people to follow as well. So, and then also, adults know this, you know, if you're going to cough, you're going to sneeze, do not do it into your hands, please. Use your elbow. And the reason is because you use your hands for so much. You touch your face, you're shaking people's hands, do it into your elbow. So therefore you don't have the respiratory virus in your hand and spreading it along. So those are like the simple things you can do.
Things
that
you
I think
start doing right now. Exactly. So what about some other things that we can do? So, you know, when someone comes to me in the ER and they're not feeling well and I diagnose them with, you know, the flu or a simple cold, one of the first things I tell them to do is rest. Okay, your body needs rest. When your body is at rest and not running around doing everything that it needs to do, your fighter cells and the cells that are also looking for viruses and bacteria to help you,
like your surveillance.
Your surveillance or your fighter cells, like that's when they're able to work their best. So make sure that you are resting. If that means you need a day off work, hey, you need a day off work so that you're at home and just resting your body. When you're resting, which includes sleeping, right, making sure you're getting your adequate amount of sleep, you're decreasing your cortisol levels. And I'm not sure if you know, but elevated cortisol levels suppress your immune system. So that means you can get sick easier and stay sick for longer.
Other elements that increase your cortisol level, stress, right? I know for myself personally, when I'm really stressed and I'm run down, I'm kind of emotionally deprived and I'm not getting enough sleep, that's when I'm most susceptible to getting sick, for sure. So that also includes kind of controlling your stress levels, keeping a calm, woosah environment to keep your cortisol levels down and allow for your white blood cells to work in their full capacity.
Yeah, I mean, it's a good excuse to say no to all those things you don't want to go to and all those things you don't want to do. I am resting my immune system. Okay?
Hydration.
Oh gosh, I mean, we could talk about this all day, as you know, at Quench, we're here to quench your thirst, but it's just amazing the things that water can do for your body. Okay, so we could talk about all the benefits, but today we're going to focus on immunity. Okay, staying hydrated again helps these fighter cells and these surveillance cells to properly function the way that they're supposed to.
There's another benefit also in your respiratory tract. You have little brushes. They're called cilia. And these cilia, their job is to kick any kind of mucus and bacteria out of your system. They help with your cough reflex that you have, also with your sneezing to kind of kick those bacteria out. They only work well when they're lubricated and hydrated. And where do you get your lubrication, your hydration from? Drinking your water. So it's also important from that end to allow your full system to work. Not just those white blood cells, but now your cilia are working a little bit better as well.
So we talk often about how much water you're supposed to have in a day. And kind of the simplest way to think about it is to actually take your weight in pounds. So let's say you weigh 180 pounds. You divide that by 2. So what number do you get? 90. Okay. So 90 is the number of ounces of water that you're supposed to have a day. And that's just standard. with nothing extra. For example, if you live in a warm environment and you're sweating often, or you work out, or you're sick, your needs are going to be a little bit higher, so you can increase your water intake during those times. But the minimum that you need is 80 ounces, or 90 ounces,
Sorry.
180 pounds. And then a standard bottle of water, I don't have one near me, but a standard bottle of water is 16.6 ounces. So, trying to get maybe 7 of those a day is, or 6 or 7 of those is what you would need if you weigh 180 pounds.
And I know you mentioned that if you're sweating a lot, but hey, that also includes a fever, right? When you have a fever, you're actually evaporating out the water out of your system, so you need more during that time too. There's a few other things that people can do to increase their immune system. That includes increasing your vitamin C, right? So the key thing about vitamin C, which is very interesting, we were talking about this just yesterday, I think. We don't make vitamin C. Did you guys know that?
Not at all. But yet it's an essential vitamin. So you have to get it from outside sources.
And so some of those outside sources would be oranges. I think everyone knows that, like your citrus-like fruits, but also, pineapples. Kale has a lot of vitamin C in it too. Broccoli has a lot of vitamin C in it as well. Cantaloupe, that's another one that has a lot of vitamin C in it too. And so I know a lot of people take multivitamins, but those multivitamins,
or even just vitamin C tablets.
Oh yeah, vitamin C tablets. A lot of those multivitamins have 75 to 95 milligrams of vitamin C in it, right? This is an important one, so pay attention, right? 75 to 95 milligrams of vitamin C in those multivitamins. In fact, I have one.
And if you
it's
look,
a one a day.
And if you look on the bottle, the FDA recommendation says that if you get that 75 to 90, that's 100% of the vitamin C that you need in a day.
So I'm going to talk about this a little bit more. So when the FDA is writing this on the back here, this is the minimum amount of vitamin C that you need to prevent yourself from getting scurvy or allowing yourself not to be deficient. Scurvy. Scurvy is an illness that was way more common way back in the day, and people would have like bleeding gums and lose their teeth from it. It was all related to vitamin C deficiency. Thanks to vitamins and a lot of fortified foods, we're able to keep the minimum requirements in our system that are allowed so that we don't get these ailments.
Right.
But
what about the benefits of getting more than that, right? That's just the minimum. But vitamin C is actually very, very immune protective, and the doses can far outweigh that 90 milligrams.
And especially if you're trying to do more than just prevent scurvy, right? If you're trying to protect your immune system from getting sick, you need mega doses of vitamin C. If you are already sick, you need mega doses of vitamin C.
So the standard, we took a look at a couple of vitamin C supplements, and so a dose would be about 1,000 milligrams, and then they recommend that you can take it up to 3 times a day. So that's
like the airborne one, right?
That's like 3,000 milligrams.
So one thing that we offer at Quench, because we really encourage people to live the best versions of themselves, right, is we offer an immunity blend. And I want to hit on this. The reason why that immunity blend is so powerful and so popular during this season is it offers vitamin C, it offers B12 complex, it offers zinc. Oh yes, we didn't even talk about zinc yet. Oh my gosh, you guys are in for a treat. Glutathione.
As well as the infusion, the fluids.
Yes, fluids. Oh,
because
we're
talking about hydration.
Each one of those elements offers something of benefit to your immune system. So we kind of already alluded to the vitamin C component. We know vitamin C, we don't make it. You need it from supplemental sources. It helps boost your immune system. We already talked about the hydration component and how that helps your system. But let's talk a little bit about zinc, the benefits of zinc. So zinc, the great part about it is not only does it boost your immune system, but if you catch a cold or a flu, it shortens down that course so quick, right?
So like nature's Tamiflu.
Hey,
brand that.
Yes.
Right. And zinc can be taken as an oral supplement too, but unfortunately for some, it can cause some GI upset.
It's a lot of side effects.
GI upset. And so when we tell people who are taking zinc by mouth, we recommend taking it at night so that you aren't suffering from those symptoms.
And food in your system.
But fortunately with our infusion, you get to bypass the gut, and so that zinc gets delivered directly into your immune system.
And you limit the systemic, side effects of the nausea and the vomiting that can come from it. And so then also we have taurine in there too. Taurine is also a great one that helps with the immune system. It helps mobilize those fighter white blood cells and those surveillance white blood cells. So once again, rallying your troops. And then what was that last component that I wanted to say? Glutathione. Oh my gosh. So glutathione is like the world's, like nature's best detoxification agent and vitamin. A lot of people just don't know about it. What's great about it is it helps reduce the stress that's on the cells within the body. So it allows for your cells to work at their best. Keep in mind, every time you walk down the street, you're exposed to viruses and bacteria. You're exposed to pollution. All those add stress to the body and damage your cells. Glutathione helps you repair all those cells so the cells can work better.
Yeah, I don't know if you guys have heard of free radicals before, but glutathione helps to eliminate those. So that's another way that you're protecting your immune system.
So just to put it in perspective, how great this immune booster infusion that we have is. So the immune booster is like the equivalent of having 86 medium-sized oranges. I only have 2 in my hand. I wish I had a bushel of them. We probably could all handle the 86 in our hands. 86 oranges plus 2 pineapples and 4 cups of broccoli. How many people can eat that in one day?
I can't.
No.
Sounds like a mega super
Couldn't eat it.
smoothie.
I don't think.
You probably have like diarrhea after.
All those fruits and veggies.
So that's
but there's
how
no way you
powerful.
can get that in. Yeah.
It's extremely powerful. So that's another way that you can boost your immunity. You know, come through and we'll give you a boost to kind of get you on your way here.
What else did you have back there?
Oh, I had your. I have all my props back here. I just had some masks, right? So, you know, should you happen to be sick, you know, you could wear a mask. I
In
would.
case you're one of those people who I do not think you should not go to work or school if you're sick. You just shouldn't, because you're passing everything on to people. But if you have to,
You can get this from like Walgreens, CVS.
You can keep them at home.
And yeah, you just simply put on the mask. It's really simple. I can show you guys real quick.
Demonstration.
Demonstration time.
yes.
Over your ear here, over your ear here. And it has like a little wire part, and you just squeeze that over your nose, and then you pull that down.
We're protected.
Yes.
Mm-hmm.
I mean, I actually see people walking through the city like this.
Oh, yeah.
So.
Yeah, I mean, I recommend that if you're like on buses and trains a lot, it's not a bad idea to just have a mask, you know, just to kind of protect yourself, and if you happen to be sick, protecting others from what your viruses are.
Definitely. Do we have any questions, Brianna?
We do. Well, you touched on it. A lot of people were asking about the natural remedies for the immune system and for the flu.
Yeah, we did talk about, you know, the vitamins. What about like the teas, right?
Oh,
Yeah. Well, before you, there was a question about
sure.
the water, about staying hydrated. People wanted to know, did it matter what kind of water? So spring water, distilled water, alkaline, tap water. Is there a difference?
So for our purposes, no. We just want you to drink the water.
Right.
There's some people that believe that like the alkalized water is better for our bodies, kind of more natural and comparable to what our fluid system is. But for my purposes, any kind of water that you want.
Yeah, for this purposes of this discussion, the alkaline water, that one I tend to recommend, especially if you're like a performance athlete, because you get yourself in an acidic zone with your working out, and then therefore that will be preferential. But for immune system, no preference. Hydration is good. But as you mentioned, the teas.
Oh yes, so teas are great because not only is it a way for you to get your fluid in, right, because you're using water to make your tea, but you can use a lot of the natural vegetables and herbs that we talked about to get some of like your vitamin C and some of these other like antioxidants. So one that we really like is ginger tea, natural ginger tea. So all you have to do is cut up some ginger. You can throw some lemon in there as well. Steep it in hot water for about 20 minutes. And then if you want, you can even add a little bit of raw unfiltered honey because honey is actually anti-immunity medication too.
And a cough suppressant.
And kids love it. Like a teaspoon of honey, it coats their throat, like they feel so much better, but it also helps boost their immune system.
And then also another one, echinacea. A lot of the tea brands out now, they have like a lemon ginger echinacea component to it because they know echinacea also boosts the immune system as well.
And when you're getting your immunity blend at Quench, you actually get a complimentary cup of echinacea lemon tea because every infusion that we have, we like to synergize it with a beverage that also complements your infusion.
Oh, you know what? Now that we're talking, there's one other thing that I forgot to mention that can help boost your immune system during this time period. Actually, exercise. Hmm. So regular exercise, because it also jumpstarts the immune system as well, encourages circulation and blood flow, which is how the immune cells, those white blood cells, get to the source of infection. So keeping a regular exercise program, through this season is very essential for.
Yeah, I'm sorry. And then remember we talked about cortisol levels too. So exercising also reduces your cortisol levels, so therefore boosting your immune system.
Since it's holiday time, a lot of people are traveling. So what can they do to, I guess, even more boost their immune system while traveling? And can you also touch on why traveling kind of depletes your immune system a bit?
Sure.
Maybe do that one first.
Yeah. So traveling definitely. I mean, it's crazy because traveling does affect your immune system a lot for a lot of different reasons. So number one, think about the fact that you're like in an airport and then in a plane and then in another airport and maybe another airport, another plane, where you're just breathing in this recycled, stale air, that you're coming into contact with thousands of people because they're touching the doorknobs and the chairs and anything else that might be in that environment, and it's just circulating. It's just like a closed system, so you keep constantly getting re-exposed to the viruses. Being in those environments like the airports and the airplanes also causes dehydration. Think about how dry you get when you're in the cabin, your lips, your skin. You're probably not drinking as much as you normally would, number one, because a bottle of water costs like $5 and they only give you one little cup. You have to like ask the stewardess for another little cup. So it's very easy to get dehydrated when you're traveling.
Especially with the water.
Yeah, I mean it happens. So those are a couple big reasons why traveling can really really take a toll on your immune system.
And then also, with these long travel times, people aren't sleeping well. You ever tried sleeping on a plane in those upright seats? It's hard to get the rest that you need, and if you're doing long trips, lots of like layovers, that's also dampening down your immune system.
Traveling is stressful, which will increase your cortisol levels. So that can also be a hit to your immune system. And not even when you're on the plane or in the airport. Thinking about when you're actually away from home, you tend to not eat or drink like you normally would. You tend not to use the bathroom as often, like your whole kind of flow, is off, and your body can feel that, and more importantly, your immune system can feel that too. So a lot of the things that we talked about can still help, making sure you're staying hydrated, trying to get the sleep that you need, boosting yourself, with your teas and drinking water. But you can definitely also come in and get an immunity blend at Quench before or after your travel. And we actually have a Jet Setter blend too, perfect for those that are on the go.
Which is what I should have got before I left.
And that's what actually a lot of people do. They're like, hey, doc, I'm going to travel in like 2 days. When should I get this immune system boost? I said, come in now, just get it done, an hour in and out.
So travel, so then also with travel, what can they do to prepare themselves? So I think that sometimes you just boosting some vitamin C, right? If you know you're about to travel, just take some extra vitamin C.
Absolutely.
And then, this is the craziest thing, but I heard, and I believe it to be true because it did start working. You're supposed to open those vents all the way.
I
You mean the
know
ones
this.
like above
Yes.
your... Oh.
And they
So
said
is that kind of like how in your car, how you can do like the closed system loop of air circulating versus the open
I guess
loop?
so. And so I read this a while ago, and so because I was always closing them as soon as I sat down, but now I'm like, okay, so I open it. I'm like, okay, it's not crazy, it's not horrible, and I'm like, I was like, well, if it's gonna help, so apparently that's supposed to help you to
Learn something new
to do
today.
better when you travel. Hopefully it helps. I don't know. I know there's drugs on the market. We are not here selling anything, so people have thought that we were. And see, she read it too.
Oh, really?
Yeah.
No.
We're not selling anything, but there are drugs on the market that people take for travel. I've never taken any of these drugs. Have you?
No, I
So I
haven't.
don't know if they work, but I know that they've made lots of money, so maybe they do work.
I mean, I feel like the number
The
one
one lady
thing-
was on Oprah, and so I'm not mentioning the name of the drug.
okay.
But
Right, Oprah.
and she actually sold the drug to a big company for a lot of money.
Oh.
So apparently, maybe that works. I've never used anything,
Okay.
but but I have used the Jet Setter blend, and it did work. I did not use it this time, and I really do think this is a whole allergy thing that we're just.
The
really?
stuffy nose that you're having right now. Oh, okay.
Yeah.
Okay.
But But I did use the Jet Setter blend, and I did fly across the country and back again in a short amount of time, and I did not get sick. So, and I went from cold weather to hot weather, back to cold weather. So, yeah, but then this week I
I'm glad you mentioned this. You know, one thing that I hear all the time, I've been hearing this since I was a kid, right? My parents are like, oh, if you don't go outside and bundle up properly, you're going to catch a cold in that cold air. What do we think about that? And the cold air causing you to get sick?
It's not true. I walk every day. And you know, I walked yesterday even.
I believe it.
And yes, I sounded like this. I walked in the cold. And I walked on Monday too, sounding just like this. And I'm not getting worse, I'm actually getting better. So it does it. And then my mother thinks I'm crazy, but I often walked around with wet hair.
Oh yeah,
that's another myth. Didn't have a problem with that either. So I mean, you need to wrap up with what you need to wrap up with. I'm not gonna get frostbite, so I have gloves on. You know what I mean? If you need to wear a hat because your head is cold, then wear a hat. I don't have a hat today.
So there is some mild truth to this, a little bit of truth, and I want to just tell you what that little bit of truth is. The thing is, when you go out in the cold, it does dampen your immune system. So in that way, it makes you more susceptible to getting things if you're not dressed properly. Because you have to think about it, when you're out in the cold, your body has to rally down to promote heat in your body. And so the circulation is just dispensing itself in a different way. So in that way, you put yourself at risk. But the cold in and of itself.
The virus itself, no. And then also just thinking about like our asthmatics and COPD, like cold air can be an irritant to the lungs. And so yes, you may have a coughing spell or something like that, but you're not going to get a virus because of the cold air.
And if you're an asthmatic, make sure you cover your mouth and nose. I am an asthmatic. And so I do actually have a little thing that if I don't have a scarf on, I have this little apparatus goes over my head that literally just covers my mouth and nose, and it has little holes in it so that it doesn't fog up my glasses, most importantly, so I can see. But yeah, definitely make sure that you cover your mouth and nose if you are asthmatic, because I know that the cold air can take your breath away, literally. Literally.
Especially in Chicago.
Especially in Chicago, near the lake, yes.
Yeah. Another thing that people commonly say with the cold weather, they say that because of the cold weather, it doesn't like kill the virus, and that's why I hear all sorts of things. But that's what we're here for, is to talk about all those type of things. Reason why people get sick during this time period is because the cold weather doesn't kill the virus, et cetera, et cetera. Well, I don't know about that part. I don't know. I don't have any research studies to back that part up. But what is true about the cold weather is people tend not to go outside. They tend to be indoors a lot in a closed loop environment, recirculating air and viruses. So in that way, the cold weather can then people susceptible to getting sick, but not the cold weather in itself. Yeah.
So I just want to reiterate one thing, because I keep reading and keep reading and keep reading. We are telling you that you should get your flu shot because, one, we are all physicians. And two, I think we probably all know somebody who died from the flu. Unfortunately. And that person did not get a flu shot. So therefore, we are saying that you should get a flu shot, particularly if you have a compromised immune system.
Any of those vulnerable populations that we talked about.
Right. Definitely you should get a flu shot. My only thing is that those people that died, I know that their loved ones wish that they had gotten a flu shot. And so I really want to just say that we're not getting paid by any company to tell you to get a flu shot, but we're telling you that the numbers last year were really through the roof of people who died from the flu. And so it is very much advised that if you can go get a flu shot, that you get one. There was someone here that said that they're a cancer patient and their doctor insisted they get a flu shot. And that would be
that makes sense,
one of the vulnerable populations that definitely needs to get a flu shot, because of her cancer treatment, she probably has no immune system.
Zero.
And if you're walking around and you give her some, and you don't wash your hands or whatever, you could definitely kill her.
Getting the flu shot can also help to protect other people.
That was my
It's not just about you. And when we talk about, it's called herd immunity, but like if the more of us that get flu shots, the that we're going to see the flu.
Right.
And it protects all of us.
And we've seen that in a whole lot of vaccines.
Yeah.
Polio vac, the
Yeah.
measles, the
Mhm.
if everyone gets them, then these things disappear.
That's
We don't have to worry about it.
too, right? Because
right?
we talk about vulnerable populations, but what about if you live in a household with someone that is in the vulnerable
Yeah.
population?
Right.
You know, if your wife, your mother has a horrible asthma, heart disease, or has cancer,
Right. Or
To
you have a
protect-
pregnant wife or daughter or something.
Or
Yes.
little baby at
Yeah.
home,
Mhm.
get your flu shot.
to protect the rest of your family.
Mhm.
Yeah, because I actually did recently hear of a story of a young child who was sick, not feeling well, and they go to the doctor, and literally days later, the child was dead.
Well, that's
The flu.
devastating.
Gosh.
And that's horrible. That's
Yeah.
horrible. That's a nightmare. Those poor parents. But just get the flu shot. Just
Mhm.
get the flu shot because you're going to protect you and everyone around you.
Exactly.
Mhm.
So were
And
there any,
definitely take those steps to boost your immune system. I
Yeah.
mean, these are things you can do on a daily basis
Mhm.
to boost your immune system. So it's simple. We're not asking a whole lot, and if you can't get your 86 medium-sized oranges and 2 pineapples and 4 cups of broccoli in,
And 80 ounces of
oh,
water.
and 80 ounces of water in, if you can't do that, because, why can't you do that? Come into Quench and get an immune boost. I mean, there's no reason why you can't.
And you can get the immune infusion every couple weeks. So, you can
Yeah.
just continue to protect yourself throughout this entire cold and flu season.
yeah, before my holiday travel.
Yes.
You blend. So, because I got my boss blend yesterday, but somebody asked what's the Jet Setter blend. What is in the Jet Setter blend?
Oh,
So the Jet Center blend also has the high dose vitamin C.
Mhm. Also, a little bit to a different degree, though, right?
Yeah.
It's about half the amount that we had in the immune
In
blend.
the immune blend.
Mhm.
It also has the vitamin B12
Mhm.
that helps give you a lot of energy, as you're getting ready to start your travels.
Mhm.
Obviously, there's the fluid in there
Mhm.
too that comes with the infusion, so you're going to be able to be hydrated.
Mhm.
Again, pre or post. So it can help you boost yourself before you travel, or if you come back and you're feeling jet lagged and just kind of out of it can help with that too.
For sure.
Mhm.
Somebody said, what about those with sickle cell anemia? So that would be part of the vulnerable population.
Absolutely.
You should definitely get the flu
Yeah,
shot.
you should be getting the flu shot.
And then somebody wanted natural remedies for postnasal drip.
Mm. Yes, I was
Yeah.
just going to. Okay, go ahead.
No, you were going to talk
Oh.
about it.
Yes. So the neti pot, we actually have one in our house, and so all it is just a little bit of warm water. Sometimes I put a little salt in it too. It helps me out with my kids. So a little warm water, and then you just drain it into your nose and kind of wash everything out. Very
So
simple.
literally you pour it in
Mhm.
and it goes around and it'll come out the other
Yes.
end.
Thank you.
And they actually have those on the market too. We are not selling those
No.
either. But they do have them at the store. If you don't want to just use something at your house,
Yeah.
they actually sell this as a thing at the store.
And make sure to read the instructions, because you can't just put regular tap water in there. It has to be clean water.
Mhm.
This is going through your sinuses, so you don't want this. You don't want to get exposed to anything.
Right, your
Yeah.
sinuses are
doing that.
Your sinuses are
Good point.
near your brain.
So they
So
tell
you definitely don't want
yes,
that.
They tell you,
Yes.
you can boil the water before
Mhm.
to make sure that it's as clean as possible. But just please don't pour tap water and just try to put it in your nose. That's not a good idea.
You're right. Absolutely. Another thing is too, is sometimes, I forget what the formal name is for it, where you kind of take a big pot of boiling water, you could put a little lemon in it, you could put a little bit of peppermint oil in it.
Oh, and
Mhm.
yeah.
Yeah, and then put your head in it.
That
That
steam.
Yeah.
steam bath maybe?
Nasal steam.
Nasal steam, branded.
Right.
So you just put
And
a
even
little,
some of the humidifiers now, you can get
Oh,
the
essential oils.
the
on
oils
there.
on them, and they'll just sit there and let it,
peppermint, lemon, and tangerine are really good ones to kind of help during this time period. Yeah, and then you just let it kind of go into the air, and that really helps with the sinuses because you're breathing it in.
They also make little tabs of eucalyptus that you can put in the shower. So when you're in the shower, it
that's nice.
slowly
The
dissolves
vapor.
away. And then you'll get that aroma in your shower as well.
Yeah, so I hope all of this has been very helpful. I do want to say one more thing. If you're deciding not to get the flu shot, just make sure that the advice you're taking is from a medical professional and not from your great grandmother or your coworker or your friend. Just a little note there. But anything else you see? Does apple cider vinegar help boost your immune system?
I don't know
I'm not sure about
what
that one.
immune.
They said it does a lot.
Mhm.
I'm sure we could find
Right,
somewhere
you're right. It does do
where
a
it
lot.
says that it can help your
I mean, it
immune
helps
system.
with digestion
Yeah.
and the immune cells in the digestive system. But I don't know about the respiratory system per se.
Okay.
Mhm.
Anything else, Brianna?
No, I think that's it.
Okay, well, thank you, everyone. And if you have any other questions, you can always go to Quench Wellness, their Facebook page, and ask them, or you can go to blackdoctor.org and they'll get the questions to us. And if you leave the comments here, we'll go through them today and we'll try to answer any other questions. But thank you so much, and everyone have a great day.
And stay healthy.
Yep.
Take care and drink your water.
Yes.